the next 25 minutes, we're going to have Donald Light. He is a low-key visiting professor at Stanford University and professor of comparative health care at the University of Medicine and Dentistry of New Jersey. He is an economic and organizational sociologist who compares health care systems and pharmacological policy. As a founding fellow of the Center for Bioethics, he has become concerned about how few new drugs are clinically much better than existing ones, yet causing substantial risk to patients. Prescription drugs are the fourth leading cause of death. From the numbers I've seen, it could be the leading cause, and result in 2.2 million hospitalizations a year. Professor Light is a co-author and editor of The Risk of Prescription Drugs, 2010. His research has appeared in leading medical and social science journals. And I've got the book right here, The Risk of Prescription Drugs, Columbia University Press, Social Science Research Council series on privatization of risk. And it's got the boil down here, how do prescription drugs become a leading cause of death? The risk of prescription drugs. And you know, the numbers I've seen in the news are 300,000 drug-related deaths. That's almost rivaling heart attack, cancer, and automobile accident. So is it the fourth, the third, the second, the first? Doesn't matter. I mean, it's you hear these drug ads and, oh, having trouble, needing to urinate a lot? Well, take this. Now, it'll give you brain cancer, have a heart attack, you may go insane, make you suicidal, blood clots, but doesn't matter. Call your physician if you think this is right for you because you're a doctor. It's incredible. So we've got him on with us for the next 25 minutes, and we'll certainly have him back up again for a full hour in the future. Professor Light, thank you for joining us.
Well, it's a pleasure, and I've been reading about all the great things that you've been doing, these wonderful documentary films and interviews. It's very impressive. I'm really delighted to be talking with you.
Well, I'm delighted to have you on with us, sir. We've got limited time, so I'm going to try to sit back and shut up. If you were talking to a auditorium at a city council and you had 25 minutes to talk to them, what would you say?
Well, you've summarized the main finding that we had in this little book that's only the size of a 5x7 photograph and only 160 pages long. It was written for general lay audiences with short, easy to read chapters, and it describes, as you say, that most of the new drugs are little better than existing drugs. I have a table here. Out of the 980 drugs that were approved in the last decade, only 40 were regarded as important therapeutic advances. So that's about 4%, and another 106 were judged clinically to be superior to existing drugs, and all the rest were judged to add little value. Now, why is that? Well, that's because the FDA approves drugs against placebo, placebo meaning a pill that is inert. So, and you don't know whether you're taking the active new drug or the placebo, and that's what is done in a clinical trial. And then you see whether the people who took the active drug got better against some criterion that the trial is for. But that means that when the FDA approves new drugs as more effective and better, and drug companies talk about as being more effective, what they really mean is more effective than an inert pill. In fact, the FDA is prohibited from ruling whether new drugs are better than existing drugs. And on the safety side, they approve them as safe with very little evidence about their safety because the trials are designed to minimize evidence of safety. And so the actual evidence they have about whether these drugs are safe for you is pretty minimal.
Well, an example I would use, Professor, is I know how to read the insert of a drug. I mean, I'm not a rocket scientist, but I can read it. Yeah. And Gardasil vaccines, they admitted in the trials, killed quite a few people. It caused autoimmune responses. And then of the hundreds of different papillomaviruses, they admitted it only covered 6 or so, and then it said this may not even stop you from getting cervical cancer. And then the literature went on to admit that it's only killing a few thousand people a year, and that's normally treatable. And so the benefits are far outweighed by the dangers, but Merck just comes into Texas, gives a bunch of money to the politicians, and they come out and say, hey, little girls, and now they're saying little boys, you got to take this so you don't get this cancer virus. I mean, right there, it's just incredible.
Right. I was told that doing the interview with you was like quickly going 60 miles an hour. So you're absolutely right. I'm not an expert on Gardasil, but you've put your finger on the new blockbuster era. So the companies have figured out that they can make vaccines or vaccine-like things that they will call vaccines because the definition is being broadened for a wide number of conditions. And about every half year, we will see a new vaccine. While for the last 25 years, you didn't see a new vaccine very often. And the prices will be about $70 a dose, and often you need 2 or 3 of those, so it'll be like $200, $300, $400. And you're right that they're the vaccine advocates and the companies sort of market to the public officials in the departments of public health or the Centers for Disease Control simply to get these things on a list. So it's easy, cheap marketing, and then it becomes a part of the requirements for what children should take. And you're right that it's a real worry.
Well, it just builds it in that the business model of these companies is to come lobby government to push something on you. But your book, it goes over the real evidence of how much harm these drugs are causing, and more of medicine is just here. Take these drugs.
Yeah.
So continue going through the serious risks that we're looking at here.
Okay. Well, one thing I think is worth saying is that drug companies are amongst our most enlightened and sophisticated corporations, and they do a lot of serious good science. And I live in an area where there are a lot of people who work for drug companies, and there are lots of wonderful employees at those companies. What I find disturbing are what must be executive decisions that are being made many layers above by the people pulling down several $1 million a year in salaries and bonuses, above all the good staff people at drug companies. And one of the main things is that they repeatedly are heavily advertising to people to take drugs for things that they were not tested for or approved. In the last 2 years, Alex, drug companies have paid $6 billion in fines from prosecutions by attorney generals for illegal marketing and getting people to take drugs for reasons that are not approved. This includes Johnson & Johnson. Pfizer is the biggest, $2.3 billion in fines in the last 2 years. Eli Lilly, $1.4 billion. GlaxoSmithKline, $400 million. Sanofi, Merck, Eli Lilly, everyone you've ever heard of, Abbott, and then ones that you probably haven't heard. Listeners may not have heard of. All aggressively promoting to your doctors and to all of us through advertising, which, by the way, we're one of only 2 countries in the world that allow direct-to-consumer advertising, because the whole idea behind prescription drugs was for 50 years that it was your doctor who decided whether you needed a certain drug, and it was the doctor whose job it was to stay on top of developments. Now with this direct advertising, they're getting patients to go in and tell the doctor what to prescribe, and often for a condition that's not been tested for.
Well, it just gets crazier and crazier by the minute.
Yeah. So, one simple thing that we recommend at the end of this little book, which is only $15. I think it's the cheapest book that Columbia Press has ever published, and I make no money on it. It was funded by the MacArthur Foundation in Chicago, and they just paid us fees to do the writing that we did, so we get no royalties. But I just think people need to read this little book and learn about this issue and talk about it and protect themselves. So one thing that's recommended in the last short chapter is that whenever a drug is prescribed for an unapproved use, which is called off-label, but I think unapproved use really puts it on the table clearly, is assigned consent. So your doctor should hand you a piece of paper, might have one sentence saying, I understand that this prescription is being given to me by my doctor for a condition for which it has not been approved, and I agree. And I mean, I think if most of your listeners were handed a piece of paper like that, they'd say, well, doctor, what's going on? Why are you doing this? And
well, I mean, we see doctors that and clinics that aren't even checking to see what other medications you're on. And I see even young people now with big, tables just full of different pills they're taking.
Right.
I mean, and then all these weird drug interactions. What are the numbers? What do we know? I mean, how many people a year die from these drug interactions?
Well, the total estimated deaths from hospitalized patients is 111,000. But as you said so well at the beginning, it was a wonderful introduction you gave to this talk. We don't know how many more, because that doesn't count all the people who die at home, at work, driving, walking, and so forth. So it's a very limited measure that we have. And there's one of the things that really appalls me is here is the roughly the fourth, or as you say, it might be the third leading cause of death, and there are relatively few efforts to track and detail studies. So when you ask, well, how many people die from drug interactions, from what's called polypharmacy, taking 2, 3, 4, 5 drugs, I can't think of a study that actually does more than just guess what that is.
So we only know about the surface of the tip of the iceberg. Stay there, Professor. We're going to come back and continue to discuss this on the other side. Then Lord Monklin's coming up. I'm going to get you back because I've just read the summary of it and I read articles about your great book. But I want to get you back in the future after I read the whole book to really go through it when I'm more educated. But I mean, it just seems that the government freaks out about a few people dying from terrorism, but more people die from bee stings every year. But then meanwhile, you've got one of the major causes of death, and I see wilder and wilder ads for drugs where it sounds like the side effects are 1,000 times worse than what it's treating. So I'm glad your book is really trying to bring some light to this, Professor Light. And tell folks where they can get the book.
Oh, well, the best place is Amazon, and you just put in the risks of prescription drugs. My website is pharmamyths.net. That's PHARMA myths, MYTHS.net. Because I've also been looking into the claims by companies that it costs an average of $1.3 billion in research and development to bring a new drug to market, extremely expensive. And when you break down their numbers, and all the numbers are created by economists who are retained by the companies, it comes out to be a small fraction of that because they use all kinds of inflators to puff the number up.
Wow. I look forward to having you back on for a full hour in the near future. Professor, give us that website one more time.
It's pharmamyths, PHARMAMYTHS.net, and it's the risk of prescription drugs. And I thought I'd give you one example, if we have a minute,
sure,
of a misleading ad. So this is an ad for Lipitor about a few days ago. It starts with saying, did you know more than 80% of people who have heart attacks have high cholesterol? Now, how is that misleading? Well, because although it's true, 90% of the people who have cholesterol don't have heart attacks. It's a different denominator. If you start with all the people with heart attacks, most of them have 10 fingers, and 80% of them have cholesterol, okay? But if you start with the millions and millions of people with high cholesterol, very few of them have heart attacks, and the evidence is quite clear now that taking statins to lower cholesterol in people who do not already have a risk of heart disease does not reduce the probability of dying. It does not decrease it.
Well, now they want to put statins in the water. Have you seen those announcements?
Yeah. Mm-hmm.
I mean, is Big Pharma just going to take over our total, economy? I mean, it's like GMO, closely allied with Big Pharma, basically the same group. We don't want you to know this is a GMO salmon that's part insect or part eel. Oh, we don't want you to know this goat's part insect. Oh, we don't want you to know that corn in studies caused all sorts of birth defects. Just on and on and on. Professor, great having you on. Look forward to talking to you again in the future when I've had a chance to read the book.
See you next week.
You bet. Take care.
Thursday.
All right, buddy. Thank you so much for joining us.